Hey everyone, so we're going to talk about clinical documentation in this one. So again, when you're starting a wellness clinic, you're going to need a host of different types of clinical documentation in order to be compliant as well as provide a good patient experience. And so that's exactly what we're going to go over in this. So the agenda today is to go over the required clinical documentation, align those documents with your scope, preparing those for review and use, and then key takeaways. So share this course. Let's help more NPs and RNs build freedom through ownership. If you use your invite link in school, you'll get a 40% commission from inviting them to the course, especially if they purchase anything from us. Also, warning here, this is the most important video in the entire course. So you're going to want to know what clinical documentation you want to put in place in your clinic, who needs to review it, and what you need to have already prepared in order to be completely compliant. Pro tip, watch this video at 1.75 speed. That'll help you get through it a lot quicker and already start taking those steps to launch your wellness clinic. So overview here. At this stage, your goal is to define how clinical care will be delivered in your clinic. Clinical documentation establishes standards, consistency, and safety. These documents guide staff and support compliance. And then every service you offer should be supported by clear documentation. This work must be completed before seeing any patients as well. So make sure you get this done before you launch. So clinical protocols. So clinical protocols describe how a specific service is delivered from start to finish. You need protocols to ensure care is consistent and evidence-based. Protocols help guide clinical decision-making and delegation. And protocols typically include indications, contraindications, dosing, monitoring, and escalation steps. So let's hop out of here, and I'm going to show you inside of our paid course what our protocol library looks like. So now we have this library for you to use, so you can use these templates to share with your medical director in the case that you need to have one to launch your wellness clinic. So inside of this here, if we go down here to our protocol library, you will see all the protocols that we use in order to provide our services in our clinic. Now, you need to have a protocol for every service that you offer. This is not always the case with charts and intake forms where you can kind of group different things just based off how your EMR system is built. But in the case of a protocol, you're going to need one for each service that you offer. And if you do need a medical director in your state, your medical director will need to review all of these protocols and assign them. And you need to keep those on file for any case that, let's say, you were audited or something of that nature. Also, as you hire people, you need them to review the protocol so they can completely understand how to deliver the care for the services that they'll be delivering. So I'm going to click on our B12 injection protocol just to give you a sense of this. So as you can see, this is a protocol template. So first thing is the service name, who the authorized providers are, and then the supervising physician. Now, as we talked about before, it includes your purpose and indication. So as you can see here, it outlines that for B12. Then it includes the contraindications as it relates to B12. Next, the supplies that'll be needed to deliver the service, the dosage and the frequency that the service can be given, the administration procedure stepped out, so each step of providing the B12 injection, monitoring and adverse effects that could come from providing the injection, patient education and aftercare, and then lastly, documentation. So how is it going to be documented inside of the chart? So again, this is just a template for you to have a look at as far as doing a protocol. Underneath this video, I have provided a template. It doesn't have a lot of this information in here, but it's just these overall, buckets for what you need information on inside of a protocol. So that's a protocol. So we're going to hop back over here to the slideshow and talk about standing orders. So standing orders authorize certain clinical actions to be performed under defined conditions. So these do differ from your protocols, where your protocols are going through pretty much everything related to the service. Your standing orders are going to allow certain providers, for instance, or clinicians to do these services within inside of your clinic. So you need standing orders when services are delegated or performed without a provider present. So for instance, if you're a registered nurse and you're providing IV therapy, you need standing orders on file from your medical director saying that you can administer, that service and how you need to go about administering it. And I'll show you that here in a second. So standing orders support efficiency while maintaining oversight. So, right, the provider doesn't have to be present. So this creates a lot of efficiency around the fact that you as a registered nurse can provide the service in their absence. Standing orders typically include authorized actions, patient criteria, limits, and required supervision. So we're going to hop out here again. We're going to go back to our paid course. The next thing we're going to go to is standing orders. So the way we do our standing orders, we do have an overall standing order file, but I want to show you the way we typically do our standing orders are on our charts. So I'm going to go to our chart folder and I'm going to go to vitamin injection again. Well, let's do another one. Let's go to GLP-1. So you can see in our chart, their standing orders here at the top. So we have exactly the qualifications that need to be met prior to starting treatment. So you have A1C greater than 5.7, BMI over or equal to 27, body fat percentage over or equal to 20% for women or 15% for men. Treatments may begin prior to lab results, but not before initial weight. Patients have completed prior labs. What's the plan? Did you do your nurse examination? And here, when I export these, it doesn't let, but you would need to have a provider signature here saying that these standing orders are valid. So again, that's pretty much what a standing order is. It like I said, it gives you that authorization for certain clinical actions performed in the clinic. So if you're a registered nurse and you're about to administer, a GLP-1 injection, you have a sense, okay, what's the standing orders around providing this service? And so again, you want to have that on each chart that you have if you want to do it on your charts, or you can just have a document similar to your protocols that does the same thing that, again, your medical director has reviewed and signed off in the case that you need a medical director. So people like registered nurses or LVNs can actually do these services within your clinic, depending on what your state laws are, of course. But again, that's what a standing order is. Let's go back here to the slideshow. And then we're going to go over intake forms and consents. So intake forms collect patient information before services are provided, right? So this makes sure that they qualify. So you need intake forms to assess eligibility and identify risk factors. Consents ensure patients understand the service and associated risk. And then intake forms typically include medical history, medications, allergies, and informed consent language. So let's hop right back out of here, go back to our paid course, and then we go to intake forms. So we do have an intake form library as well. That includes our intake forms. So again, just for some continuity here, let's go to our vitamin injection intake form. So as you can see, it has the vitamin injection consent. So them consenting to any and all of our vitamin injections. We do this, we like to group them so they're not having to do a different vitamin injection intake form every time they choose a different one. So we make sure that our intake form covers all of our vitamins. You have your health history questionnaire, your medical and surgical history, your listed and prescribed drugs, review of systems, potential side effects for each one of our vitamin injections, and then additional consents around, hey, do you understand the purpose of a vitamin injections and why you have been recommended to receive them, and so on and so forth. So that all lives in here, including things like privacy sharing, cancellation policy, photo consent, a ton of different consents. So those all live on your intake form before they actually even get the service. And so you as a provider can then look over the intake form and determine whether or not they are eligible for the service before you give it. So next here is charts and clinical documentation. So charts are the medical record of each patient encounter. I'm sure you probably know this, but I'll go through it anyways. You need charts to document assessments, treatments, and outcomes. You want proper charting it supports continuity of care and legal protection. Charts typically include patient history, vitals, assessment, treatment notes, and follow-up plans. So we're going to right back out again. And then we were already in our chart library. And so as you can see, let's go to our vitamin injection chart. If we scroll down past the standing order and the prescription, you will see the review of systems, another health history questionnaire for you to fill out, social history, and an assessment prior to providing that service. Now, we also do our lot numbers and expirations and all those great things inside of our chart as well. But again, just giving you a sense of what these things look like. Now, inside of our EMR, this looks a lot better. Like I said, this is an export. But again, like I said, high level here, give you a sense of what's typically included in a chart. The vitamin injection chart is not super complex, but some like hormone therapy and weight loss can get a lot more complex. So we're going to go back into the slide. So some key takeaways here is every service should be supported by clear clinical documentation, protocols, standing orders, charts, and intake forms. Each serve a different purpose, and you're going to want all of them where you need it based off your state laws. All documents must align with state law and scope of practice, and these must be completed and reviewed by a medical director if you require a medical director to operate in your state prior to you performing any services. And I'm going to tell you now, I recommend that you draft these before you go looking for your medical director. And the reason I say that is because you want to build trust with your medical director early on. By having a lot of these things drafted out, not only are you going to make your medical director trust you and feel that you have all your ducks in a row, but then also they'll likely charge you less because they'll feel like there's less responsibility that they need to build these things out for you. And therefore, they're not going to feel that anxiety or level of stress that will make them say, hey, okay, you need to pay me more because I'm going to be doing this for you. If they feel like, okay, well, I'm going to have some oversight role and I'm only going to have to spend 2 to 3 hours a month, helping with this, then now that price comes down, if you know what I mean. So that's that as far as, clinical documentation goes. So if you enjoyed this course, please let us know in the community. Book a call with me if you need to get a better understanding around, clinical documentation. Book a call. We help you move a lot faster, avoid costly mistakes. If you were interested in those libraries that I showed you here on the video, we'll also can get you access to that. So we help you set up your entity with compliance, medical director matching, legal and clinical documents, your EMR, as well as marketing, and so much more. So book a call with me. On that call, there's no pressure. We'll go through where you are now, where you're trying to go, how we can help you. And if we can't help you, at the very least, we'll give you some steps to take that you can implement immediately to start moving in the right direction to launch your clinic. So thank you for watching this video, and I'll talk to you on the next one.